So we're going to go over your guys' chapter on dermatology today. Normally we kind of break the lessons apart into two different sections, but what we're going to do is go through this PowerPoint today, and then that way on Thursday we'll go over the different types of like procedures you guys will assist on, and how to like manage up different wounds, which we've kind of gone over before. But then also like suture removals, because then you'll do a symptomic skill or simulation, I should say, this week on suture removals. So this PowerPoint isn't crazy long like some of the other ones, so it shouldn't be too much to go through all together in just one sitting, but just remember that it is recorded, so it'll be posted later on in case you want to go back and review it. So yeah. All right. So we're going to go over the functions of the skin first. And the main function of the skin is to make a barrier, so it's kind of the first line of defense against pathogens. Our skin is also the largest organ of the human body. It helps to regulate our body temperature and to provide stuff about the environment around us, so telling if it's hot or cold, and then also helps with the synthesis of vitamin D, and helps to eliminate waste products from our body, which is, kind of like with our pores, how we have sweat and other fluids kind of come through our pores and everything. Kind of helps to get rid of that excess waste. So let me show I gotta get my notes up here too. So, but in an average adult, it covers a total area of about 20 square feet. So yeah, but it's the largest organ in the human body. So first, and we'll go over on the next slide here an actual image, but you have 4 different layers here. So you have the epidermis, which is the top layer here, so the part that you actually can see. You have the dermal epidermal junction, so which is basically the 2 layers of where the dermis and then the epidermis kind of meet together. So that's what this layer in between here is. So, and then you have the dermis, which is the layer of the connective tissue with all the collagen and elastin. So right in here, this larger area, which is also where, I'm sorry, the subcutaneous area is where the fat cells are, but the dermis is the layer where you have all of the connective tissue, collagen, and all that stuff. So, yeah. So here is the actual image of how your skin is kind of broken apart. So you have the epidermis here, which is the first layer. So this is the part, again, that you see. Oh, let me get Sean in here. There we go. Hi, Sean. You haven't missed too much so far. We basically just went over the main, let me actually just go back, because we went over like the main function of the skin, which is the first line of defense against pathogens, helps to regulate our body temperature, provides information about our environment, which basically, telling it if it's hot or cold outside, and that it's the largest organ of the human body, and that it covers a total area of about 20 square feet. And so now we're going into the different layers of the skin. So on this slide, we're going over your first layer of skin, the epidermis, which is the outer part that you see. And then you have the dermis, which is where you have all of the, so kind of like your hair follicles, your different, not your sweat glands, sorry, it's your tissue with the collagen, elastin fibers, and then the subcutaneous area is where you have the fat cells that will help keep the temperature regulated in your body. So, okay, so again, so the 5 functions of the skin system, or I have a hard time saying this, so this is why I just like to say skin, the integumentary system. So it's going to help protect us from external factors. It'll help us to, sensory, check the temperature outside, also to regulate our own body temperature, and then excretion, so that basically if it's too hot outside, and then we begin producing sweat to help cool us down, and then to help us with the synthesis of vitamin D. So, all right, so we're going to go over some common disorders and diseases of the skin. And again, we're going to go through this PowerPoint today, so that way on Thursday we can go over different procedures you guys would assist in, as well as like different types of wound care and how to remove sutures. So, because most commonly in a doctor's office, when you do a procedure, it's going to be like removing some type of lesion, and we'll kind of go over those different things here in a minute. So, but the most common signs or symptoms of a skin disease or disorder is some discoloration or redness around a particular area, itching, weeping kind of meaning like in that specific area there is some moisture, so kind of like almost as if that person was sweating, but like only in that particular area, or any bleeding lesions. We'll go over what the different types of lesions are as well. But then they might also see some scaly or flaky type of skin or any changing skin lesions. So they might notice like a new mole or a new area on their skin that then is changing over time, which they want to get checked out right away. So, all right. So a skin lesion can be caused by a systemic problem, such as like an allergic reaction to medication. But it could, what you would want to ask a patient is to kind of, like they were calling over the phone, to describe the lesion as best as they can. Is it painful or itching? Is there any drainage from the site? And then where exactly the lesion is at. So and then you'd also, another thing you'd want to ask them too is when they first notice the lesion. I just noticed I have a huge bug on my camera. 1 second. Sorry, you guys, I was looking at my camera and I saw something moving and there was a giant beetle on my camera. Sorry. Okay, anyways. But yeah, I also asked them as well as like, you know, these different symptoms, how long it's been there for, like when they first kind of noticed it. And then, right, okay, hold on. Sorry, let me check the chat box real quick. Oh, you thought I said oh no, I just noticed a huge bug, like on my web camera that's on my computer. I like just kind of glanced up and I noticed something moving there. Did I say lesion? I don't know. But yeah, there was this big beetle that I was like, oh, okay. Anyway. Okay. So let's go over some different skin conditions. So one of the most common skin conditions is called impetigo, which is usually caused by a staph infection. So it's a superficial type of infection, just right on that top layer of the epidermis. It can spread when you know, a scratched area. If you like, basically like, so if a patient or somebody has impetigo, which is caused by some type of staph, and they touch that area and they touch something else, and then someone touches that area or that whatever it is that they touched, and then they like, you know, scratch their face or their arm or wherever, then they can then what just happened? Hold on. They can then develop that infection as well. So they usually treat it with like a different type of topical treatment, so like a cream or an ointment, or sometimes some antibiotics. But initially it'll kind of look like small vesicles on the face. Usually around like the nose or mouth is where you'll notice it the most. And oftentimes what we refer to this in kids is hand, foot, and mouth, because of course that's the areas they touch the most. So, but it's usually just a localized type of infection. So wherever it is that they, kind of scratched at or whatnot. So on the face, yeah, usually like around their nose and mouth. Okay. Another common skin disorder is acne, which is a disorder of the hair follicle on the sebaceous gland. So acne is usually going to be like on the face, but it can also be pretty much anywhere in the body. Most commonly face, and then some, like the back is the most two common areas. But it's where the sebum and cells stick together and form a plug, which is where bacteria will grow. So you'll have like blackheads, pimples, sometimes pustules or abscesses. And that can be pretty painful, particularly those who have more kind of like abscesses rather than just regular acne. So acne vulgaris would be the ones where you kind of see someone who has more like larger abscesses. They are pretty painful for patients. So, but the best treatment that they do for that is they recommend, of course, just as always, you should do regardless if you have acne or not, is face wash, but they'll prescribe some topical antibiotic creams or retinoid creams to help with the inflammation, and sometimes they'll give them like oral medications as well. Usually with the medications that they give them, they are hypersensitive to sunlight, so they can, which will cause basically a severe sunburn or rash. So, but one of the most common medications is Accutane that they will give to a patient who has severe acne. But there's all sorts of different types of treatments for acne besides just, like the creams and the, washing your face too. Sometimes they'll do other types of procedures to help with acne treatment. But those are the most common areas that they start with, and then they'll start a patient on like Accutane or Sotret for severe acne. But we try to do as minimally invasive as possible first before we start those kinds of things. So, all right, and then you have rosacea, which is a chronic disease caused from inflammation, and it begins as like flushing across the face that then leads to dilated capillaries and eye problems sometimes. So this is one that's also treated with like topical antibiotics and then sometimes oral medications. It'll appear as pustules that get better, but then the redness and flushing pretty much remain on a patient. So they kind of always have this red area on their face is where you usually see it the most. It's most common in women between the ages of 30 to 60. And then men, they may develop rosacea as well. Anyone can develop rosacea, it's just more common in women, but you'll usually have it around your nose and then cheeks, like right underneath your eyes. And it can be pretty dry and sometimes scaly. So, all right, so a furuncle is a type of boil that lays underneath the skin, and we'll go over the different types of, here on the next slide. But it's a localized type of staph infection that begins as an inflammation of a hair follicle or skin gland. So it's really localized. It'll be a raised, inflamed, painful bump that sometimes will start draining on their own. A carbuncle is a collection of furuncles, so a collection of those boils that have joined together and then may drain through multiple different sites or form an abscess together. So it kind of might clump together and form form its own, like one big abscess, or kind of clump together and form a bunch of cells. Furuncle. But both are treated with oral antibiotics and then cleansing ointment. Or if they do become open, then usually are drained by the doctor. We'll try to get the sac out so it doesn't happen again. But, oh, I just realized that this picture is not the clearest, so I will change that. But here are different types of skin lesions and how to kind of tell the difference between, if it's a bulla, if it's a vesicle, a pustule, a palpule, a nodule. And then, you have like your ulcers, your scaly type of skin that you'd see in like psoriasis. I'll make this picture clearer for you guys because I'll post the PowerPoint on Canvas as well. So, but we were just talking about the furuncles and whatnot. So what you would usually see, it could be, usually would either be, excuse me. So for a patient, it could be a palpule, which it would just be underneath like the epidermis, but sometimes a abscess like that could be all the way down like into the dermis, which then could be a like pustule. So something that is much deeper. I personally think that they are fun to assist on, like when draining, a boil or a lesion like that. I think they are pretty fun, but a good tip for you guys, just in case, because some people really have a hard time with like different smells and stuff. And some of them can be pretty bad. So if you have either like some Vicks Vapor Rub or like peppermint lip gloss or something, to put that on and then put a mask on top, so that that's basically all you're smelling. So that's a tip for you guys. Yeah, we can watch a video at the end of this of like do you want to do the one about like draining a like a boil or a furuncle? Okay. Or you can chew gum too, but so cellulitis is an acute infection of the skin and subcutaneous tissue caused by a staph infection as well. Usually happens from like a small cut. So a lot of times this can be caused, yeah, we can do that. It can be caused by like someone, for example, like they were shaving their legs and you are supposed to change your razor, every so often, but sometimes people don't do that and they might get a very small cut or laceration. Maybe they don't even notice it. But it can then spread and then cause this great deal of inflammation that you can see clearly like between this person's legs and stuff that, they've definitely got an infection going on. So, but they'll have some pain. They'll definitely have pain. It'll look, most of the time at first they'll just notice the edema or the swelling, sometimes before the redness. So, and sometimes they may have some drain too. So, no, I mean, you don't cut it open to drain. Usually, like when someone has a massive amount of swelling, they will start having some of their own, like drainage coming out. Like it's not going to like burst open, but, they'll notice, on the skin itself that they'll have like some fluid there. So, sometimes too, like this can happen to patients who are prone to edema, like from congestive heart failure. So they have edema, then it can turn into the cellulitis, because a lot of times, like with edema, they might have like little areas of their skin that do split, and they then develop the infection. So, but this is usually treated with oral antibiotics and then warm compresses to start aid in healing. So like they'll use a compression sock to keep lots of pressure on that area to then get the fluid, out or to to make sure that it's not going to swell up too much, but then to help get all the fluid that's in there, circulating out of their system. So. I mean, anyone can get cellulitis. I wouldn't. It's more common like in the elderly, or people who have like really dry skin. Not okay. So like if someone has really dry skin, you're just more apt to having like a open area that then some type of bacteria could then enter. So, but most of the time, what a cause of this is someone who had some sort of injury. So it has to be like really dry skin, like to where it's cracking open a lot type thing. So, but it's not, I wouldn't say it's like super common. The most common reason that this happens is someone who either, again, like they use like a dirty razor, or if they got like a small cut, like, so say someone was working out in their garden and got, pricked by a rose thorn or something, and then some of the bacteria from outside entered and stuff. So. All right, so fungal infections. So basically anything that's going to be referred to as a fungal infection is going to start with tinea. So tinea pedis would be athlete's foot. And then I am not quite sure how to say this name correctly, but it's tinea, and I want to say cruris, which would be like jock itch, which is the fungal infection that is mostly for males, but can occur to females too, where you get like a fungal infection in the genital area. So pretty much any place that can collect a lot of moisture. Yeah, I mean, people with eczema could be more prone to getting cellulitis, but I wouldn't say it's like crazy common. It's just, if you have an acute injury, it's just like a little laceration. And that could happen too, like if you were riding your bike and you fell and scraped your knee, or all sorts of little things can happen that can cause that. But then at the same time, I wouldn't say that it's like a crazy common thing either. That like if you got a scrape, or if you did accidentally, like when you were shaving, cut yourself slightly with a razor, that doesn't guarantee you're going to get cellulitis or anything. I mean, if you had anything like that happen, you just, of course, want to clean it really well with some antiseptic or antibacterial soap, and just keep an eye on it. So, and then tinea corporis is ringworm, which can happen pretty much anywhere on the skin. Most commonly happens to people who are wrestling, and that's because, funguses like to stick to areas that are really moist and warm. So, like in sports, like particularly wrestling and stuff, there's lots of sweating, and then you're on those mats, and then the ringworm can then transfer to like the next player and whatnot. So, but all the lesions will be periodic with distinct borders and scaling areas. So, and actually, I didn't get a picture for this particular one, so let me get a picture of ringworm for you guys. So this is what ringworm kind of looks like, or actually a better picture of it would be more kind of like this. So it has like a distinct red circle around it, and then the dry kind of scaly skin that you can see. Did you guys see that? What causes ringworm, or what causes fungal infections? Or kind of both? Okay, gotcha. So fungal infections are mostly going to be in areas that you have lots of like moisture on your body. So like your feet, any fold that you have in your skin, and then the ringworm too. You know, again, that's most commonly happens to people, like I would say in wrestling. It's just basically an overgrowth of the bacteria, but for ringworm specifically, let's see, like what really causes ringworm. Well, I know, yeah, direct contact, yes, but like why? Because you can get ringworm anywhere. Where more like other fungal infections, you'll get in areas that just kind of trap moisture. So you know, like again, in your feet or athlete's foot, because you wear socks on your shoes, kind of trap in that moisture. In any areas like the folds of your skin. So most commonly, people will get it under their armpits, under the breasts, any folds of their skin, in between their thighs, anywhere that there's folding skin that tends to trap that moisture that doesn't really get a lot of oxygen. But it's like, okay, so ringworm specifically is a fungus that's caused by mold-like parasites. So they live on the outer layer of the skin and then are basically transferred by direct contact. So that's where someone, and again, it's most commonly in like wrestling because lots of sweating and then transfer of like body fluids or from the sweat, basically, that then they'll transfer the ringworm. But ringworm is more caused by like a mold type parasite where these other ones can just develop because of the lack of oxygen to those areas, if that makes sense. Does that make sense? I hope that does make sense. Okay. And then they'll usually do like topical antibiotics or antifungal ointments, and then just making sure to keep the area clean and dry. So, along with like antifungal ointments, they'll prescribe, suggest people to use powder in those areas. So like people who are prone to athlete's foot, they'll tell them to use like baby powder or something that'll help to absorb the excess moisture to keep the fungal infection from growing. Same with people that get like drop itch or fungal infections underneath their armpits or breasts or any folds in their skin that trap that moisture. They'll just have them use some type of powder that'll help to dry that area or keep that area dry so it doesn't keep spreading. So this is a type of fungal infection of the toe. So, or the toenail and fingernails, not the toe itself, sorry. But it lives in the nail bed and the nail plate. It'll turn their nail a yellowish color like this. Sometimes it also like thickens their nails. Let's go back. I just wanted to open up my notes. Okay, well, but whatever. So usually their nail will become a lot thicker as well. Sometimes it causes them, like as their nails grow, kind of causes them to twist, but usually they'll prescribe them something called terbinafine or Lamisil, which with that, they want to make sure that they measure their liver function every once in a while. This isn't something they're going to take permanently. This is just something they'll take depending on the patient, but it usually will take about like 6 months to treat. But they want to check on their liver function because this medication is processed through or metabolized through the liver and then can cause liver damage. But yes, this is what it will look like is if you see a patient who has or really anyone in general, if you see someone who has really thick yellow fingernails or toenails that are really opaque, and opaque means see this one, you kind of see the underlying skin underneath here, but then in these areas where it's thicker and yellow, you can't really see the skin underneath. So that's kind of what opaque means is, you can't really see through it. It's pretty dense. So, and a lot of times people can get these when they go to nail salons. Not as common now because there are a lot more regulations put into place, but that is one of the most common areas that people do obtain these types of infections from because someone may first be developing this fungal infection underneath their nail and may not even know it, and then the tools aren't always clean the best, and then it gets transferred to another person. And yeah, it's a long process for someone to be treated to get rid of it. But it's not as common now in nail salons because, you know, they have put in a bunch of regulations of like cleaning between each client and whatnot. But yeah, that's what it'll look like for someone who has tinea onychomycosis. All right. So warts, which are usually caused by HPV. So I don't think we've gone into the OBGYN chapter, but most of you have probably heard of HPV being related to like cervical cancer. And so you're kind of like, wait, HPV can be elsewhere? Yes. So HPV can also be, come in the form of warts. I don't think so. I mean, there are frogs that are poisonous, but they don't cause HPV. I don't really know if that's true. Like, you know, I mean, I wouldn't think that they would cause warts, but they could cause like lesions from like, you know, if they're poisonous or anything. So, but yeah, so HPV, it'll come little raised kind of cauliflower apparent looking like guys here. So usually happens on like the fingers, in between the fingers and feet. So this is one that also kind of grows in an area where like moisture is kind of trapped, but mostly in hands and feet. And they will usually either treat this with different topical creams. Sometimes they will do remove them surgically, so they'll just use a scalpel or blade to kind of cut off the warts. Sometimes they do cryosurgery, which is where they use that liquid nitrogen to kind of freeze them off. So, but no, I mean, toads and frogs and stuff don't cause the HPV, but I'm just thinking like, I think that kind of started because some frogs and stuff, like if they are poisonous, can cause a skin reaction or like a skin lesion. And they assumed that those were warts, but they're not. But when you, has anyone ever seen like cryosurgery, like with the liquid nitrogen type stuff? It's pretty fun. We do that a lot in the doctor's office, which actually you guys will be the ones who will be filling the canisters with the liquid nitrogen. So I'm going to show you guys a video too on how to do that properly. Because you also don't want to like accidentally, you know, pour liquid nitrogen on yourself and then end up with frostbite or something. So, but yeah, it's pretty fun because we are the ones that get to fill those canisters. And then when you're done with the liquid nitrogen, it evaporates pretty quickly, which is why we put those in those canisters so we can make sure, you know, we get full usage out of it. Never mind, I won't teach you guys that because that's not a good thing to teach. It was going to be a little prick, but that's not the best thing to teach you guys. Okay, so cold sores or herpes simplex. So herpes simplex is the most common type of herpes that is caused by, sometimes they can be caused by like a fever, or fever blisters, you might hear them referred to as, but so you have herpes simplex type 1 and herpes simplex type 2. Herpes simplex type 1 is only like cold sores that you're going to see like on their lips or basically around their mouth. Sometimes it can be inside their mouth as well. But usually someone can have this and not even know it for a really long time. They may never even have symptoms or any painful ulcers. But the virus does remain dormant in the trigeminal nerve and can be reactivated pretty much at any point. So that's kind of how, so herpes, and I don't know if you guys know this, but chickenpox is a type of herpes. So if you had chickenpox when you were a kid, it settles into one of the nerves in your body. So this particular type of herpes settles into the trigeminal nerve. So that's why they only get it when they do have an outbreak. They only get it on their mouth or inside their mouth, like their gums and stuff. So yeah, but let me check my chat box here. Yes. So when you're younger and you get chickenpox, basically when you're older, you are at risk for getting shingles, which is pretty much just a reactivation of that virus. So it settles into one of the nerves in your body. You never know what nerve that it actually settled into until you get shingles, because that's usually like when it. You don't necessarily, because you had chickenpox, will get shingles, but it is more common for you to get shingles, after having chickenpox. But of course, too, even if you didn't have chickenpox when you're younger, doesn't mean you can't get it as an adult. But anyways, when you had chickenpox when you were a kid and then you develop shingles as an adult, wherever that virus, pretty much laid dormant in one of the nerves, like whatever nerve it settled in is where shingles will appear. So if, when you had chickenpox, that virus laid dormant in a nerve in your right arm, then you'll develop shingles in your right arm. Or in like your low back. It usually is only like on one side of your body. So the right or left side, you might have it, like on the right side of your back or the right side of your abdomen or leg or whatever. But yeah, it's a type of virus that stays, it finds a nerve to settle into and then can be reactivated at any point, but most commonly for shingles anyways, it happens when you're like 65 or older is the most common time it happens, but that doesn't mean that you can't get it, when you're 50 or something. But a lot of times with like herpes, what causes like an outbreak could be stress most of the time. But again, it could lay dormant in your body for many years, and not just herpes simplex, but type 1, but also type 2 can lay dormant in a nerve where you never even have symptoms, you don't even know that you have it, and then all of a sudden you have an outbreak. And that could be, you might have had it for 10 years, but just never had it appear. So, but yeah, it's a type of painful ulcer, specifically around the lips or in the gum line. It'll settle into a nerve, and for chickenpox, like this one, again, herpes simplex type 1 specifically settles into the trigeminal nerve. And that's why they will get it on their mouth. Herpes simplex type 2 is like the genital herpes, so it settles into a nerve in that area. But chickenpox, because you get chickenpox pretty much everywhere, basically once you've had that chickenpox virus, that virus lays dormant in your body and can reactivate at any point. But again, most commonly, like when you're 65 or older. But it finds some nerve that it then lays dormant in. And you never know, like when you had chickenpox, there's no way to know what nerve that virus is kind of hiding in, basically until you end up having a shingles outburst. So, unfortunately, which would be nice if they could find a way to kind of pinpoint that nerve and maybe somehow, like kill that nerve off somehow so that way you don't ever develop shingles, because it is pretty dang painful. And that's because, basically once the chickenpox virus has settled into a nerve, then when it is flared up, you're getting a lot of that nerve pain. So it's a lot more painful than when you were a kid. So yeah. But yeah, they'll usually use some type of antiviral drugs or ointments that they put on there. Like you've probably seen commercials for like Abreva. And it'll basically speed up the healing time, but it doesn't get rid of it. It'll always be something that's there. So some people may have outbreaks more frequently than other people, because some people, again, like it can lay dormant in their body for years and never have an outbreak, or some people, they get outbreaks every single year. They already know that it's going to come, so they already have antivirals on hand to be able to take it. And in, like topical stuff too. So, all right. So some things that can happen too, as far as diseases or disorders, are some parasite type of infections. So the most common type that you would see is going to be scabies or lice. Lice can also be not just on your head, but also body lice or pubic lice too. So probably because of some inflammation from having the scabies, because she's probably like itched her hand a lot, so now it's swollen. But yeah, so the most common one that you'll probably see, though, honestly, is scabies. Because most of the time, people who have head lice and stuff, they'll treat it at home. They don't usually bring them into the doctor's office to do much, because there's so many over-the-counter treatments already that it's a pretty common one with kids that most people know how to treat it. But and I wanted to show a better picture, but this is kind of what it'll look like. And scabies, mostly when you see it on a patient, is going to be between their fingers, because they really like the warm areas. But they burrow into their skin, and a lot of times too, you kind of see like tracing along their skin because they move underneath the skin. So I'm going to show you a better image of that. Actually, that was pretty. So yeah, so scabies will they burrow underneath the skin here, and then they'll travel it looks kind of like a tunnel. So when you actually see someone who has scabies, I'm trying to get like a good picture of it. That one's not very clear. Oh, here we go. So you can kind of see like underneath the skin, it almost kind of looks like a tunnel type thing. So this, or actually there's another good picture of it too. So you can see like you can actually see like where it traveled through. So it is highly contagious. So someone who does have scabies, they can pass it to other people really rapidly. So, but basically, usually when you have a patient that comes in for scabies, one of the questions I always ask them first is like if they've traveled anywhere recently, stayed in a hotel or anything, because they could have picked it up from there. Living conditions also have a part to do with it as well. But if you ever see someone that's coming in because they have a rash on like their hands or something, wear gloves. So, oh yeah, so basically, like if you have a patient that comes in and then we do figure out that it is, scabies that is causing that, because not necessarily, it may not be scabies, it could be some other kind of dermatological thing like contact dermatitis or something. But anytime you have a patient that comes in with like some type of rash on like their hands or anything, I would just put gloves on just in case, because they basically transfer through direct contact. But if they, when they sat in like the chair or the room that they're in or anything, depending on where you work, like you may have to clean the area, or they might have a department that comes and does that type of stuff. But yeah, like whatever chair they were in, you want to pay attention to make sure that we do clean that area and the room and everything. So yeah, you have to clean everything that they touch. So And usually like the front desk people are pretty good about that. They'll like kind of note where the patient was sitting at and they'll automatically like go and clean that area and kind of close it off so no one else can go in there. So okay, so contact dermatitis. Seborrheic or contact dermatitis. Seborrheic dermatitis is a chronic inflammation caused by one of the sebaceous glands. Their skin will appear dry or moist, either one. Kind of scaly, appearing yellowish, kind of crusted over. This usually happens on like the scalp, their eyebrows, eyelids, the sides of their nose, or behind their ears. Or also can be known as like cradle cap. If you guys have ever seen cradle cap, which is in like newborns, they'll develop the dermatitis on the top of their head. But contact dermatitis would be something that is like a response to a skin irritant. So, and that's what I was saying, you know, like someone who may be coming in for like a rash on their hands, it could be contact dermatitis because if they touch like a certain chemical or something that then causes an irritant, it's just an acute response to something. So it's not like a long-term thing, but it'll appear red. Sometimes they'll have some edema, or edema meaning swelling, and then we'll have some of these vesicles that you'll kind of see here. So this is what dermatitis looks like. Let me show you cradle cap. So it happens like in newborns, so they kind of develop this flaky, sometimes it can kind of be moist, but the majority of the time it's dry, but it'll like a yellowish, kind of crusty, flaky rash on their head. And it's not painful or anything, kind of looks more like dandruff. And I mean, it's pretty common for babies and stuff too. So yeah, you just basically comb it out and then apply some ointment and stuff to it. So, okay. So eczema. So this is a chronic skin disease that's caused by some inflammation. It tends to occur in people who have really like skin allergies or sensitivities. Sometimes they can be caused by like food allergens. Stress can make someone's eczema flare up, or specifically temperature changes is one of the most common ones. So if you have like extreme heat, that usually will cause an eczema flare up because the constant sweating will make their skin irritable and then cause itching, but also at the same time, extreme cold, especially like if it's dry weather, that will cause them to have like the skin will start to crack and then they'll have like lots of itching and everything. So most of the time they will have eczema likes to flare up in like behind the neck, the elbows, like the inner parts where your elbow bends, basically, behind the knees, behind the ears, any folds in the skin. Eczema likes to really be in those areas, your wrist, between your fingers. But the goal or how you kind of treat eczema is finding out what triggers that response in a patient. So some people don't have issues like with certain temperatures. So, you know, like extreme heat doesn't cause them to have an eczema flare up, but then some people, you know, maybe it's stress that causes their flare up. It depends on the patient. So the treatment would then to reduce the number of outbreaks, but also to kind of reduce their exposure to those particular elements that cause their outbreaks. So, but the way that they treat it is with topical corticosteroids, so like a cream or ointment that they'll use, and then also antihistamine. So, eczema, they'll prescribe allergy medications to help them with, those outbreaks. Because a lot of times, again, not only can it be like food allergies, but it also could be all these external factors too. So, but yeah, someone who has eczema, besides the topical corticosteroids, they'll usually for patients, you know, like scented body washes and stuff can be a trigger too, or lotions. So they'll have them use like really soothing products like oatmeal soaps, so that it's less likely to cause inflammation or kind of like an allergic reaction type thing. But that's what eczema looks like. Psoriasis, basically, it looks somewhat similar to eczema, but it's a chronic skin disease that is actually caused by an autoimmune response. And it produces like a pink or reddish lesion that's then covered by like a silvery, scaly, you know, dry skin. So you can see like underneath it is pretty red and inflamed, but the skin that lays on top that's all dry is kind of like a silver color to it. So this is one that's this isn't related to herpes, but it does have flare-ups, so it can lay dormant and then reappear throughout life. So they may not have it all the time. But it's caused by an autoimmune reaction that speeds up the maturation. I cannot say this word, I don't know why. Whatever. Anyways, how the skin cells reproduce and everything. So, but there's not really a cure. There is different treatments available, like Humira, which treats a lot of different autoimmune issues for people. But it's basically like where, you know, your cells constantly are reproducing, and it's just, you know, your immune system, for whatever reason, speeds up that process. And so you're like having an overgrowth of your skin cells. And it is usually pretty itchy too. Another condition that this is not one that's very common, but it's common for people who do have, you know, chronic lung diseases, also people who have psoriasis. But anyways, so lupus is a type of autoimmune disease, and the way that it appears as far as externally is someone will usually have this butterfly rash here. So it's kind of like on their nose and then through their cheeks here. So that is like the external factor of it that you'll see. And usually with this, because rosacea also tends to be in that area as well, you know, like the nose and then the cheeks. They'll usually do a skin biopsy to see if the rash is being caused by lupus. But again, like this is because of an autoimmune disease. This is just the external factor of that autoimmune disease. But they'll usually, you know, they'll need to use lots of sunscreen and then avoid sun exposure. And they'll also use corticosteroid creams or ointments to help with that inflammation. It's not a real person. This is like an animation. It's a really good animation though. All right, so we're gonna get through burns and then like cancerous cells and whatnot. So, but the different types of burns that you might see. So superficial burns or first degree burns only affect the top layer of skin, so the epidermis. So only that top layer. Partial thickness burns, or what's called second degree burns, completely destroys the epidermal layer and then part of the dermis. So that first layer of skin is completely destroyed, and then part of their dermis is now affected. A full thickness burn is a third degree burn, which destroys all the layers of the skin. So the epidermis, the dermis, the sebaceous gland, all of that stuff. So, and then a deep full thickness burn or fourth degree burn is pretty rare, but then extends beyond, you know, like the subcutaneous tissue into like the muscle and bone. That one would be pretty rare. So the second one could be usually like a partial thickness or full thickness burn will cause those pustules. Most of the time though, like what you guys will see, if you guys have a patient that you are treating or providing wound care for burns, it's going to be first or second degree burns. Third degree burns, they're most likely going to go to, the hospitals call it a MAC clinic, but they are like specialists in wound care of like all sorts of wound care. Fourth degree burns, someone's going to be in the hospital for that one. So you would not see a fourth degree burn. But yeah, second and third degree burn, or I'm sorry, first and second degree burns, you guys will likely do wound care on. You might see third degree burns, but most likely, again, they're probably going to go to a specialty clinic that is specifically for wound care. So some cold injuries, this basically would be someone who was exposed to cold temperatures for a prolonged period of time, which would be like frostbite. Not something that you'll commonly see, particularly in our area, but it usually, fingertips is the most common area that someone develops frostbite. A lot of times it's something that just needs to be treated with consistent warming of the area. Very rarely does it develop or does it result in an infection or amputation. And if that was the case, it's not something you would see that. You're okay, Suzanne. All right, so carcinoma or skin cancers. So there's 3 types of skin cancers. The basal cell carcinoma is it most frequently appears from sun exposure and kind of appears like a pearly or waxy bump here, which is this guy right here. So it doesn't really look too much darker or different from the regular skin, but of course it is enough difference that you can see it. A squamous cell carcinoma appears also after sun exposure, but is a firm red nodule or can be flat with some scaly or crusted surfaces, which is this guy right here. So underneath it's pretty red, but it does have that kind of crusted over area. Oops. And then a melanoma, which is what is a malignant tumor. It can develop anywhere in the body and can affect people of any skin color, but it'll usually, so a normal like mole or skin lesion would be pretty much perfectly symmetrical and would be one even color. Here you can see that it is not symmetrical. It is a roundish shape, but it's obviously not perfectly round. But it's darker on this side and lighter on this side. So if a mole or a skin lesion is not just like one solid color and does not have even edges, definitely want to get that checked out. So, yeah, like a mole, like it'll have all even edges. Usually, will look, pretty cylindrical. Sometimes might be raised, kind of looks like an eraser. But if it has uneven coloring, that is something they want to have checked out. People who are exposed to the sun are most likely to develop skin cancers. But we're going to look at the A, B, C, D, E rule. So first, they want to look at the asymmetry. So does one half of the mole match the other half, or again, like the color? So like on that last slide, one side of that mole looked darker than the other part of it looked lighter. The borders, so are the edges of the mole blurred or irregular? So like are the edges all symmetrical, or are they all kind of jagged and all over the place? Again, the color of the mole, is it the same color throughout, or does it have different shades within it? The diameter, so the mole is larger than 6 millimeters, which is about the size of a pencil eraser. That is another factor, like it could potentially be skin cancer. And then also if it's elevated. So, which again, a mole that is raised doesn't necessarily mean skin cancer, but if you had a mole that was once flat and now all of a sudden it's raised or it's grown, that would be a little suspicious. So treatments for skin cancer just kind of depend on what type of skin cancer we're dealing with. So treatments for basal cell and squamous cell would be what they call it a Mohs surgery, which is where they are going to be, it's a micrographic surgery. So they are taking, have you guys ever seen like a skin graft where they've removed a very like thin layer of the skin? Kind of almost with like, not a cheese grater, I don't know why I'm thinking cheese grater, but they remove a very superficial layer of that, like say they saw that basal cell or squamous cell, they're going to remove very thin layers of it until they make sure that they've gotten all of the cancerous cells out. They may do an excisional surgery, which they would then remove the skin and tissue around it. They might just do a topical medication that gets rid of it, or like cryosurgery where they use that liquid nitrogen to freeze it off and it gets deep enough into those layers of the skin that it's going to take everything out. Treatment for melanoma just really depends on like the size, the location, and the stage of cancer. So it could be like a really minor localized surgery to where they just do an excision. We'll watch some videos on that on Thursday, and I don't think we have enough time today, unfortunately, to do that, but we'll watch videos on Thursday of the different types of procedures you guys are most commonly assisting. But yeah, like for melanomas, it really just depends on, location, size, and stage. So they might just do an excision, which could be like an outpatient type of surgery. But depending on the stage and everything, they might have to do radiation and chemotherapy. So, but with a dermatological examination, you might help the physician. So, I mean, like the doctor will inspect the entire body. You might just be in the room as like a witness because they, depending on, male, female, those types of things, they might have you as like a witness in the room. Depending on the comfort level of patient too, but they will do like a full body inspection. So they'll check all of the surface layers of their skin, like their back, their arms. Most commonly, like the areas that are going to be most commonly exposed to the sun. Any suspicious areas that they see, they're going to palpate, kind of feel around, and then also they might do some specialty testing. So they might just remove a very small area of the mole or lesion to send out to be biopsied to see if there is any cancerous cells. But usually what we'll have to do is just tell the patient how to prep for the examination, which is usually like they'll just change into a gown that opens up in the back so that way they can, expose the area of skin that they're examining at that time. So, but yeah, again, so we'll go over and look at videos on excisions, punch biopsies, and shave biopsies, and how you guys would be assisting in that. So that way, because pretty much anytime you do an excision or punch biopsy, they're going to have to come back for a suture removal, and then that will be the Simtex thing you guys will do. But we'll show videos on like what that looks like when you're actually in the doctor's office, and then what your part is as far as like assisting in those procedures. They're pretty fun. So, with the different burns, so again, and I'm sorry, I somehow did not organize this slide correctly with the other ones, but again, first and second degree burns, you'll most likely be bandaging and assisting with. Third and fourth degree burns, those require immediate medical attention, but someone who has fourth degree burn is probably going to be in the hospital for a while. All right, so the Mohs surgery. So again, that's where they like really remove very superficial or layers of the skin, and they'll look at it underneath a microscope and examine those layers until they don't see any more cancerous cells. So they will, remove a thin layer, look at it underneath the microscope. If they still see cancerous cells, they'll remove another layer, look at that under the microscope, and so on. I am not familiar with the ultraviolet therapy, so I'm not quite sure how that works, but I guess it's used to treat a number of different types of skin diseases, like psoriasis. So they use like an ultraviolet type, um, light in some gel, and then apply to that affected area for about 10 minutes. I've not seen that before, but that does sound pretty cool. Some other types of procedures that they might do is like a chemical peel, which they would use a type of chemical agent to remove a small, very superficial layer of the skin. Microdermabrasion, which basically evens the layers of the dermal tissue. Sometimes they might do laser resurfacing, which is used for very fine lines, wrinkles, pigments, shallow scars, tattoo removals, and then Botox injections, which will just temporarily paralyze facial muscles that causes wrinkles to form. So, which Botox is also used to treat migraines, but that's a whole different thing. But yeah, so basically what we'll do is on Thursday, we'll go over the different types of procedures we get to assist on. They're really fun to assist on. And actually, let me open this better. Oh, Sean, you are so young. You do not need to have Botox anytime soon. Or ever, really. I mean, the fine lines and wrinkles and stuff, those are just part of aging and stuff. And that's, I mean, I don't know why people think it's an issue, but yeah, I mean, we did a lot of Botox injections for people who had chronic migraines. But yeah, I'll show you guys videos on like an incision and drainage of like of a boil or cyst, which is one that you guys will commonly assist on in like family practice, as well as excisions and biopsies. And then we'll go over suture removals. But I'll also go over with you guys, not just like in the videos of like the actual excision and all of that kind of stuff, but like what the medical assistant's role is in those procedures. Because of course in those videos, pretty much like they focus on what the doctor themselves is doing. But I want to talk to you guys too about like the setup for those procedures and then what you kind of do during the procedure. And that always kind of depends on the doctor that you work with, because some doctors are really self-sufficient and do everything themselves, where others need more help. And then also like the aftercare and stuff. So yeah, any questions on any of that stuff? I know that was a lot that we went over, and again, I will put the PowerPoint and everything up there for you guys to review throughout too. All right, cool. Well, then we are good. And then I will get this posted here soon. Oh, no worries, Sean. All right. And then, yeah, I'll get this posted up here soon, and then I will talk to you guys on Thursday. See you guys later.